Maternal Mental Health Matters Talks Birth Trauma, hosted by Pregnancy, Birth and Beyond. I'm Analia Tia. Birth Trauma Awareness Week 2020 runs from the 7th to the 13th of September. Throughout the week, tune in to insightful, thought-provoking, and deeply honoring stories and discussions with people who have experienced birth trauma, clinicians and researchers in this area, and maternity advocates working to change the system. In this episode, you'll be hearing from Professor Jenny Gamble. Welcome, Professor Jenny Gamble, to Birth Trauma Awareness Week. Thank you for joining us today.
My pleasure.
Professor Jenny Gamble is Head of Midwifery at Griffith University and Director of the Transforming Maternity Care Collaborative. You're going to be speaking with us today about the contributing factors to psychological trauma in childbirth, where women report that their birth was traumatic, and the development of trauma symptoms. And you'll also be discussing helpful early responses. Thank you so much. This is such invaluable information, and I'm grateful for you joining us today.
It's my pleasure to be here. I think this is an important topic, and I'm really glad there's a focus on it for this week. It'd be good if there was a bit of a focus on it in an ongoing way, but of course it starts with first raising awareness. So I'll just start off by talking about psychological trauma broadly and generally. I'd like to make a few distinctions, but I think that they'll become apparent as I go along. In the research that my colleagues and I have done, and in fact has occurred across the globe, it seems pretty clear that a large proportion of women report that their birth was distressing, and a proportion of those women report that their birth was traumatic. They feared for their life or their baby's life. They were concerned that they or their baby would be seriously damaged or permanently injured. The fear that's created is partly attributed to the quality of care. So I'm talking about here traumatic birth and psychologically traumatic birth, but there are overlaps. So I'm not talking about complications from childbearing or complications from giving birth, everything from requiring a cesarean section to a perineal tear to any physical complication. I'm talking specifically about psychological trauma, and it's different from having a simply distressing birth. You can be unhappy with aspects of the way that your birth went, but to call it traumatic, you had to have some genuine experience. It's still about your experience of feeling fearful that you or your baby will be damaged or die. Seriously damaged or permanently damaged, doesn't matter, or die. So the work that we've done, around about 30% of women will report that their birth was traumatic and also have 3 or 4 trauma symptoms at sort of 4 to 6 weeks after the birth. So they're experiencing ongoing distress from what happened around the time of birth. It seems that factors that contribute most to the development of trauma are related to 3 broad categories. One is poor technical care. So where they just felt like their care providers didn't provide them with competent care. So that could be a misdiagnosis or a late diagnosis. It could be that they didn't carry out some procedure effectively or efficiently or in a timely fashion. It could be that they actually made mistakes in that executing of the care. So technically competent care was one of the factors contributing to the development of trauma symptoms. The other factor was around what you call communication, partnership, informed choice, participation in decision making, really feeling like that you were included in all aspects of care and that you had choice and control and that your voice was heard and listened to, and that the decisions were not made in a coercive or overbearing way, that you were provided with the opportunity to participate in decision making and give informed consent. The third aspect, I think, is quite controversial, but the data is really clear. You're more likely to develop psychological trauma symptoms if you have an operative birth, forceps, vacuum delivery, or vacuum birth, or a cesarean section, particularly a cesarean section done as an emergency procedure. So although you can develop psychological trauma and trauma symptoms from a vaginal birth, it's often about what else went in with that vaginal birth that will lead to the trauma symptoms, either poor technical care, poor communication and lack of involvement in decision making, or in fact some significant complication of childbearing that might occur in the context of a vaginal birth. So yes, you're much more likely to have trauma symptoms if you have a cesarean section, particularly as an emergency procedure, forceps or vacuum. However, there are other factors contributing to it as well, and it is absolutely about how you perceive or experience the birth as opposed to somebody else telling you what qualifies as traumatic, psychologically traumatic. So it sometimes is unusual that a woman could have, say, lose her baby, give birth to a very preterm baby, or have a stillborn baby, and she might be grief-stricken and she might be distressed, but she also may well not be traumatized. So trauma is different from those sorts of things. So there's a range of experiences and understandings and even levels of distress, and not all of them are psychological trauma. So then we say to ourselves, okay, well, what is a good approach about all of this sort of thing? How do we best manage this? Well, obviously some of this is very, very preventable. So providing technically competent care should be the norm, and I would say is the norm, but there's always an opportunity to continue to improve care. I think we still have a long way to go with really involving women in the process of care and providing respectful maternity care. And of course, we could readily reduce the rates of obstetric intervention. And I know that that's a global problem. And I know that the global maternity community, including consumers, including obstetricians and midwives, are concerned that we should pay attention to that. So I guess that brings me on to the next part, which is, well, if a woman is reporting their birth was traumatic, how do we best respond? One of the things that's been consistently found is that, in fact, women they're not even asked how the birth went for them. So soon after the birthing experience, so in the first, hours, days after birth, it's important there's an opportunity for women to be asked and for her response to be heard about how the experience went for her. How did it go for you? It's a simple question, but if it's not asked in a context with sufficient privacy and sufficient time to hear the answer, then it can sound a bit like, have a good day at a checkout in the supermarket. So we've found over consecutive studies now that less than 20% of women get asked about how their birth experience went for them. And if that simple question is asked genuinely, authentically, and time given to hearing the response, we have an opportunity then to really get a deeper understanding of what that meant for her and acknowledge her experience, and then connect her to other sorts of ongoing care that are likely to reduce her trauma symptoms if in fact that's the road she's headed down. So it helps, for instance, for women to understand the sequencing of events. So just to get a very, very clear picture about what happened, when and why. They'll have their own views. Women's memories are very accurate, but they don't necessarily understand why things happened, and preferably that should have happened at the time. But even in retrospect, it's better that women have a full understanding of the whole journey than to be left in the dark. And sometimes when they understand how things all happen, the sequence of events, it helps them get a coherent narrative about the journey and fill in any missing pieces, and that in itself is useful. They may want to have the opportunity to tell people who they felt didn't do the right thing by them, what their experience of being on the receiving end of that was really like. And so all of those experiences, all of those opportunities can be facilitated for women. And even really, really understanding her feelings, hearing how she's feeling and why, acknowledging that, validating that, respecting that, can also help her feel more centered in herself. So she goes, okay, well, I'm not overreacting. Yes, I have a healthy baby, hopefully, but it's more than that. And people can hear me and know that my distress is real, and that would be expected after everything that the woman had been through. I've done quite a lot of data collection for women in relation to traumatic birth experiences, and talking with those women afterwards, one of the things that they seemed to be a very strong theme was the self-blame. So they blamed themselves for just about everything. It was really distressing to hear. So they'd say, I chose the wrong doctor, chose the wrong hospital, went to hospital too early, shouldn't have had an epidural, should have had an epidural, should have asserted myself more, should have asked more questions, should have done more preparation before I had the baby. And from my perspective as a healthcare provider and a professional, I think that that was extraordinarily hard to hear, because in fact, if we're getting it right, if we're providing maternity services that really focus on the needs of women, then I usually say there shouldn't have to be a mini health professional to be able to navigate the system. They should have the care provided to them when they need it, in a way that they need it, and with their full inclusion and participation in decision making. So it does distress me to hear that. And if you have a woman who's voicing those sorts of things, I think it's really quite important to unpick where responsibility lies. The responsibility's got to lie with health professionals about making sure the woman has access to timely and accurate information as she journeys through becoming a mother. I can't see any effective way around that that really provides women with an understanding of what to expect, what to reasonably expect from healthcare providers. So I think those few things are early, useful approaches to women who are reporting their birth was distressing or traumatic, and really acknowledging and validating their feelings is important in all of that. Sometimes people tell me, well, you can have a post-traumatic stress disorder and a traumatic birth, a psychologically traumatic birth, from a normal birth as well. And I guess I would just stress a little bit that you had to unpick what goes into the normal vaginal birth, because these days so much of birth is so heavily medicalized. But let me give you just one little example. One of the women I spoke to had really a very scary situation where she had antepartum hemorrhage. So she's bleeding heavily when she went to hospital. The baby was a little bit preterm, but not seriously preterm. Her partner was with her, and she said, from the moment I arrived, people talked to me, talked to my partner, told me exactly what was going on, didn't pull any punches about the seriousness of the situation and the risk to my life or my baby's life. But I absolutely felt they worked as a team. I absolutely felt they were on my side. I really believed they were technically competent, and everything I saw demonstrated that. And I had a really frightening birth experience, but she said, but I'm just so grateful that they all were so capable and so caring. And she said that there was one midwife who seemed to be designated or assigned just to keep her and her partner fully informed. So she said she stayed up the top of the bed with me and just spoke to me and explained everything as it went along. So clearly a dire emergency, but not a traumatic event. So I think really unpicking what's gone on in the whole experience is really critical to understanding women's responses to it. And the other thing out of all of my research that strikes me time and time again was that the responses that women have are, in fact, normal responses to distressing, traumatic, difficult, sort of abnormal situations. In closing, I think I need to talk a little bit about the notion of human intent. When we take psychological trauma out to the broader literature, beyond childbearing women and post-traumatic stress disorder associated with childbirth, then I think a clear picture emerges that where there was human intent in the harm, people are more likely to be traumatized. So whether that's a natural disaster, if you can call it a natural disaster, like a bushfire, there's a huge difference between feeling like all of the people did what they should have done at the time they should have done it. Emergency services, neighbours and friends, family, the government, if everybody sort of did what they needed to do, you had your early warning system in place, help was available, you had the right information, even if the circumstances are extraordinarily difficult and even if they're tragic, it seems that if there was no malice or betrayal, no human intent in the harm, and in fact that people had done what they were supposed to, are trusted to do, then people are less likely to report a traumatic experience. So that goes hand in hand with the aftermath too. How we deal with things in the aftermath of a traumatic birth experience can either contribute further to the trauma or in fact can ameliorate the trauma. And there's now quite a big and growing body of literature about growth through trauma and post-traumatic growth. And you certainly see that in some women who, despite psychologically traumatic experiences and the distress that follows and the work that they did to help recover and grow, is then they're often very, very influential, empathetic beacons of light in our community that support childbearing women broadly. So there is also that potential for post-traumatic growth, and that in itself is very powerful and I think a very positive message for hope after a traumatic experience.
You've been listening to a special series on birth trauma hosted by Pregnancy, Birth and Beyond and brought to you by Maternal Mental Health Matters Australia, a collaboration between 4 peak Australian consumer advocacy groups, Safe Motherhood for All, Maternity Choices Australia, Maternity Consumer Network and PBB Media. For more information, head to pbbmedia.org.